All right, so the 5 rights of case management are right care, right time, right provider, right setting, right price. Just wanted to bring that up. Okay, so back to chapter 13. Okay, so community models of case management. There's the Liberty Mutual Insurance Company, telephone-based collaborative care for post-cardiac patients, and then there's state government agencies like Council on Aging and Social Services. So let me pull up the video on Liberty Mutual Insurance Company. So for some reason my models of case management video isn't working, so we're going to move on. All right, advocacy skills for a case manager. The nurse advocate makes the client's rights the priority. That's when you aim to promote self-determination in the client group. And so the process of advocacy is informing, supporting, affirming, and systematic problem solving. So looking at different alternatives, illuminating the values to help you prioritize things. So as an advocate, making sure someone's getting the best care possible, making sure their needs and wants and goals are known, and that they're realistic, right?
Profile. My name is Carl David Bridgewaters. I'm not sure which first name we used on my thing, so I'll use both of them. And the job title that I chose was a family advocate / case manager. My example organization is the Westminster Family Resource Center, which is located here in beautiful Westminster, California, Orange County. My contact for this assignment was the Center Director, Susanna Herrera, and her contact number is 714-903-1331. The FRC is a city-county collaborative, which is housed under the OC FACT, Facting Families and Communities Together. It's a small center with 1 director and 5 full-time staff, or make that a part-time staff. The only full-time member is the director. It's set up as a one-stop shop for families to receive services and has two full-time counselors, actually part-time counselors, from Western Youth Services, which are out-stationed at the center to provide therapeutic counseling. The stressors in this facility is, at the time, our clientele is mostly comprised of Hispanic families. Many are well below the poverty level and in need of several types of services each. It's not just one type of service. There's a high rate of domestic violence within the clientele, and English literacy is at a minimum. So we have a hard time sometimes finding services that are in Spanish and are local. Also, we have a high rate of people not following through with the services that they're given. Also, as you can imagine, dealing with people's problems 20 hours a day can cause problems. That's my doorbell for all my dogs. The typical benefits, this is a part-time position, so there are no real benefits except for the newly federally mandated sick leave. The job of the family advocates are responsible. They do the initial intake for families coming into the center. They're then responsible for linking the families with whatever services the families are in need of. They continue to work with the family until they're either successfully and anxiously engaged in the services, or they are no longer receiving any services. They're also responsible for demonstrating or to present the case at the weekly case management team meeting. The education required for this is either a BS in a related field, either sociology or family, or in the case of the counselor currently there, experience. There's only one pay scale for this position, and it's by time with the city, and that's opening at $15 and closing at $22 an hour. And that is my information about this position. Thank you, and have a nice day.
Okay, so that talks a little bit about advocacy. So conflict management skills for case management. Case managers help clients manage conflicting needs, and scarce resources. So part of it is, all right, what do you do when somebody has to work every day to support themselves and their family, but they desperately need to rest after an MI? What can you do to help with those conflicting needs? And as part of being a case manager, part social work, or at least connecting them with the social worker, right? And education. So I had a patient who had an MI, and the case manager there was like, let me hook you up. Now we're going to set you up with cardiac rehab. And it's really important that you do that after an MI so that you don't get readmitted. And she refused it and said she had to go back to work. And the case manager offered to set her up with resources so that she could go to cardiac rehab, but she didn't do it. And then she came to me a few months after her MI and was saying, I can't continue working. I'm having chest pain while I work. I'm feeling really sick. You set me up with those resources that the case manager set me up with. And I unfortunately don't have access to those resources. Those are resources that are more accessible when you're in the hospital. And my case manager didn't know how to get those resources for that patient. And that's part of that is, education. And part of that is just education of the patient that, you have to trust your case managers at the hospital. And when we tried to get her back in with those case managers, they had said, that's all gone now because it's been X amount of days after discharge. And trying to get her those resources, it was a lot harder. She ended up having another MI and had to stop working. It was really tough trying to help manage that conflicting need. Mutual benefit with limited loss for everyone is the goal of conflict management. So there's negotiating, assertiveness, and cooperation. So part of it too is cooperation from the patient, cooperation from other resources, and your own cooperation. So collaboration skills for a case manager. So it's your goal to promote respect, understanding, and accuracy of communication of all team members' points of view. So, you are going to be, if you're a case manager, you have a big job of collaboration. And that involves getting all the disciplines together and working together and working with the patient. Also making sure that the patient collaborates toward a goal of care. And that might involve the family or their resources and support systems. So you need to know about the client, their health status, what resources they have, what treatments they're getting, who their community providers are, the complex needs of themselves and the families, their interpersonal, medical, nursing, and social dimensions, and then of course the team member and leadership skills. So as a case manager and you're collaborating with all these different disciplines, with the patients, with the families, you have to be able to juggle all of that and still keep it in line with the patient's goals. So also having the ability to discuss realistically what are realistic outcomes and goals for the patient in terms of all of this milieu. Issues in case management. Okay, so there's legal issues. Liability concerns of case managers exist when the following conditions are met. The provider had a duty to provide reasonable care. A breach occurred through an act or omission to act. The act or omission caused injury, damage to client. So as a case manager, you have some responsibility when you're collaborating with all these interprofessional departments, and so making sure that you do act so that things don't happen. And there's ethical issues. A patient has the right to make decisions for themselves, and though you're a case manager, you're not there to force anything on someone. So making sure that you're in line with the patient's decision. Beneficence, so do no harm. Are you doing more harm than good? Having somebody go to physical therapy when maybe you need to talk about hospice. Justice, is it fair? Are you not providing a resource for someone due to money or a language issue? And that happens all the time. our Nepali patients can't go to any of the free eye doctors because, community eye doctors, because they don't provide interpreters. That's injustice. So how can we correct that injustice, or at least get them the resources? Non-malfeasance, so do no harm. Sorry, beneficence is providing good. Non-malfeasance, do no harm. And then veracity, telling the truth. Are you being honest? Is the patient honest? Are other providers being honest? When you keep saying, if you keep pushing, you're going to get better, or, this resource isn't available to you. Is it not available to them, or is it just really hard to get it for them? That sort of situation. So those are, all medical ethical issues. So that is the end of the case management section, and we will meet in the next section to talk about Chapter 14.